is academic science. Like, how can we do things better? You know, I don't, it's really interesting because my wife's a physician. For her, the excitement is to go to a bush hospital in rural Africa and take care of sick kids. For me, it's exciting to go to a bush hospital in Africa and figure out why they're sick, get the resources to clean the water, you know, all that stuff. I'm sort of more of a systems person. So that's why I ended up doing, I think, what I did. And she's a physician at Lawndale where she's worked for 15 years. I'm going to go to our actual program. Give you some data on HIV because that's really what it was built about. I'm going to go, all right, we'll start here. So at the end of year 2005, about 40 million people had HIV in the world. And the thing to keep in mind is that the vast majority are in sub-Saharan Africa, and then a big chunk in Southeast Asia. Most people believe that Asia is going to explode with an AIDS epidemic, predominantly in India. But right now, sub-Saharan Africa bears the overwhelming burden of HIV infection. There's a lot of reasons for that. Part of it has to do with dislocation. People, workers going off to distant cities, unfortunately men visiting prostitutes, bringing HIV back to their wives. It has a lot to do with the sheer math of polygamy. So if one man has HIV and he has 4 or 5 wives, there's going to be more infected women. It has to do with some really, what I would consider ugly practices of when a woman's husband dies, she's passed to somebody else to have sex with her. And so there's a lot of property use of women that is really tragic. And I think, again, as Christians, we can speak against those things. And the Christian church is actually growing mightily in Africa, which is pretty exciting. So children under 5, estimated to be living with HIV at the end of 2005, it's 2.1 million. So 2.3 total, almost all of them are in sub-Saharan Africa. So I spent a stint in my career, and if some of you listen to NPR, you might have heard me on the radio yesterday talking about jail healthcare. I spent a stint as the medical director of Cook County Jail, orchestrating healthcare for people incarcerated. And my friends used to always say, well, why did you go work in a jail? And I said, there's a sort of a famous story about a bank robber named Willie Sutton who was arrested, and they said, why did you rob banks? And he said, well, that's where the money was. And so what I said about the jail was, why did you go to jail? Because that's where the need was. That's where the infectious disease were. Well, why do I want to work in sub-Saharan Africa? Why am I working in sub-Saharan Africa? Because I'm a pediatric infectious disease specialist, and that's where the kids are suffering. And so it makes sense. That's where all the HIV is, so you need to be there. So some of the trends in HIV, this is the deaths in sub-Saharan Africa. So that line is going in an absolutely tragic and wrong direction. What has been the impact of HIV? This is one that shocks me and I think is astonishing. So the lines up there, the dotted lines, those are life expectancy curves. So what you can see is that in the 50s, it was pretty bad in Africa. Life expectancy 45, life expectancy 35, and things were getting better. Things were going quite well. Development was occurring, a lot of progress, and then right in the 80s and 90s, HIV hits. And life expectancy is just absolutely plummeted. So that you have life expectancies in places like Malawi, Botswana, Zambia, all located in southern Africa in the upper 30s, 38 years or so. So HIV is totally decimating the population. There are whole villages that are abandoned. There's actually land speculators from the West, so from North America and Europe and Japan, going in and buying up property in Africa, hoping that it'll be worth something someday because it's just available, because people are just dead and there's nobody there to claim the land. So that's been sort of the secular response to somewhat. Estimated number of children living with HIV, newly infected in 2005. So I don't know if some of you are really into knowledge about HIV, but we have ways to prevent a pregnant woman from passing it to her baby. And in this country, it's rare. And the reason it's rare is because if mom takes medicines and we do the right things around the time of delivery, we give good care, then mom will not pass it to the baby. If nothing happens to mom, nobody gives her health care, then she's got a 25–30% chance of passing it to the baby. Well, in sub-Saharan Africa, nothing's happening for the women, so they're having babies with HIV. But in North America, it's pretty rare. We deliver about 50 to 60 HIV-infected women a year at Cook County, and in the last 5 years, we've not had an infected baby, so it can be done well, but it requires healthcare resources. As you heard, there are 15 million AIDS orphans, so these mean kids who are either infected or uninfected, but whose parents have died, and so they're orphans. In Malawi, it's very interesting because in Malawi, they do not, I'm not going to talk about education, but it's very, I'm going to touch this one because this one is one of my pet peeves. I think, here's my cynical side, which I think is actually contrary to being a Christian. You shouldn't be a cynic, but I think there's a confluence of really bad things going on. I think deep down in our core, people in the West and the North are kind of racist, and we actually don't care so much that black people and brown people are dying with AIDS. And I think we also are a little nervous because we've spent years buying into population explosion, that it's a bad thing, and we really value wilderness areas and we want to keep protecting wilderness. So I think, although you won't hear them say it in public, I think a lot of the drive that has stalled us doing anything is we're basically racist, and we basically are okay with a lot of people dying because we kind of think there's too many people anyway, as long as it's not me that's dying. So a Christian, of course, has to stand up and speak against those loudly and say that's hideous. You know, all people are made in the image of God, we learn in Genesis. And so as a fellow believer who knows that every person on earth is made in God's image and is of immense value to God, I cannot stand and watch that happen. And certainly I have to speak against racism, and both in myself and my brothers and sisters. So, but the question comes up. I gave a lecture once on vaccinating children in developing countries at a church on the south side of Chicago, and a woman raised her hand and said, well, if we vaccinate them, won't they just live? There'll be too many of them. Is population a problem? Well, what's really interesting about that is if you look at population history, all of the Western European countries, US, we all had these astronomical growth rates, late 1800s, early 1900s, and we had all the, quote, population problems. And what did we do? Did we go around giving Depot, Provera, and passing out contraception and doing vasectomies? No, what we did is we educated people, we developed. And what happens is human beings are pretty smart. When we realize that our kids will actually live, and they'll get an education, and that there'll be enough resources for me to survive, I will self-regulate. I will decide that I don't want 8, 10, 12 kids. So I think it's really, really pejorative of us to look at another country in a developing state and say, what you really need to do is stop having kids. I think we need to look at them and say what you really need to do is educate your women, which is, by the way, the single best way to drive down birth rates is if you educate women. So you need to educate your women. You need to provide health care for your kids so they don't die. You need to provide economic opportunity. If you do all that, then you don't have to worry about the big debate of the conservatives versus the liberals. Do we do family planning or don't we? I think people will self-regulate. So my answer to the population problem, quote problem, is let's not worry about it. Let's worry about providing the things that we know will help people make healthy choices. Okay, so where do we go from here? And then I'll finish. Although actually I have a ton of slides on this. So this is my acute respiratory project. And what I wanted to say is, I've already said it to you, so I'm just going to tell you what we did. So these are what we do. We go to all these hospitals, we put charts up on the wall, we train all these workers. Every year we go back to all 24 hospitals, we train 10 people, we go back the next year, we got to train new people because 2 or 3 of the people we trained last year died of AIDS. That's one of the big problems with HIV in sub-Saharan Africa. The teachers and healthcare workers are dying, the leadership is dying. But we keep going back and training. Malawi is way down there in southern Africa. It's, as I said, a small country nestled next to Mozambique. Was a major player in the slave trade, so there's a history there that, of course, you have to be mindful of. These are the demographics I've already given you. It's the place where Dr. Livingston once was, and so it's a lot of Presbyterians there, a lot of Christians. One of the cool things about Christianity in sub-Saharan Africa, it's absolutely exploding. People are turning to Christ in amazing numbers of ways. But what it is it's a Christianity that's a mile wide and an inch deep, and they really desperately need pastors. They need well-trained people to go there and teach. And actually, InterVarsity does a lot of training of young people there. So we travel around, we teach people. This is one of the wards. Often there's 3 or 4 kids per bed in the district hospital, people passing meds, Kasunga, talking to a patient. I'm trying to go fast and be mindful. When you're in a hospital in Africa, the kitchen is just an area outside where your family cooks your meals. I would encourage all of you to try and spend some time working. I will say that once you've worked in Africa, because I've worked on the west side of Chicago, I grew up on the west side of Chicago, it's amazing the difference in poverty. I mean, you go to Africa and it's so absolutely abject poverty. You come back and it's just mind-boggling. Okay, this is if you're a physician. Are any of you guys pre-med? It's like yes. There's a few of you out there. Probably not really raise your hand. But this is this healthcare worker who's a high school graduate who we've trained. He's going to see 350 kids under the age of 5 between 9 a.m. and noon. That's his volume of flow that he